Department is announcing the second case of COVID-19 in our county. A man in his 70s is being treated at a local hospital. We have with us Nita Ludwig, Public Health Administrator in Rock Island County, and Ed Rivers, Director of the Scott County Health Department. They do not have prepared remarks today as this is only a press availability. Please type your questions in the chat box. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. We expect to have a media briefing on Wednesday, but please watch your email for details. With that, Brooke, what questions do we have?
We don't have any yet. We did have one small piece out that Ed was going to give some remarks on. So I'll give him just a second here to give some information while we get some questions in the chat.
Okay, thank you.
Okay. Well, I can say that we don't have any cases in Scott County to announce, but we have become aware of a number of poisonings in the U.S. and elsewhere where people are swallowing or gargling with bleach, taking things like acetic acid or essential oil, salt water, ethanol, or other supposed cures or preventative measures that they may have heard about on social media or from other people. And none of these things protect you from getting COVID-19, and some of the practices may be dangerous. Our advice to the public is not to take any kind of treatment or product that's not recommended by your healthcare provider. As we continue to reiterate, the best way to protect yourself from this virus and other viruses, including the flu, include washing your hands often, using soap and hot water, avoiding close contact with people who are sick, sneezing or coughing, and avoid spreading your own germs by coughing into the crook of your elbow and staying at home when you're sick. If you find yourself experiencing mild symptoms of COVID-19, such as fever, cough, or shortness of breath, stay at home to avoid spreading it to others. If your symptoms become more than you can manage at home, call your healthcare provider, explain your symptoms, and they will determine how to best help you. And as a reminder, make sure you're using reliable sources to gather your information. Local health departments in the Quad Cities, the Iowa and Illinois Departments of Public Health, and the Centers for Disease Control are all good sources of information.
Okay, thanks, Ed. We just wanted to put some of that information out there. Looks like we do have some questions that have popped up. First one, well-intentioned people keep contacting us that they have sewing masks, or that they are sewing masks for hospitals and others to use. Some are using HVAC filters or vacuum filters. Are those safe, recommended for use by anyone? Okay, go ahead, Ed.
I do know that our emergency management agency is coordinating an effort with the fire departments to employ some of these methods, but they're not meant to be like an N95 mask where it's protective against COVID. These are for other types of uses. This may be what you're hearing about.
Nita, have you heard anything on your side?
The same thing. Our emergency management agency is also working in coordination with Scott County, as we have been on the entire response. But the only mask that the CDC considers safe from getting COVID-19 is the N95 style mask.
Next question, this is referring to the information Ed just shared. Are these poisonings happening in Scott or Rock Island counties?
I have not become aware of any in Iowa. You may have seen reports last night and today of a man in Arizona who died from, and his wife is in the ICU from drinking a home remedy made from an aquarium additive.
Do we know if this man contracted the coronavirus while traveling? Oh, I'm sorry. Yep, that would be to Nita. Would you like to answer that?
Sure. Our infectious disease nurses are still gathering that background information, so I cannot speak to that at this time.
Next question. Can you give us an update on the testing shortage? Are we still in a shortage?
We aren't the people to be asking about testing. We don't have access to testing information as a local public health agency in the state of Iowa.
Anything to add to that, Nita?
All I could say for Illinois is that when patients meet the criteria for testing at the Illinois Department of Public Health lab, we are still giving an authorization code, and they are still receiving the tests that they need.
Okay, the next question, have the criteria for locals to get tested fundamentally changed or meaningfully expanded since last week? What are those now? Nita, that might connect back to what you were just saying with the authorizations.
Sure. For the Illinois Department of Public Health laboratory testing, they do need to fall in one of two criteria. And the first one is that specimens from hospitalized patients with severe acute lower respiratory illness, for example, pneumonia, that would be a candidate for testing, or specimens from clusters and congregate settings that serve more vulnerable populations, such as supportive care, assisted living, group home, homeless shelter, or nursing home. For private labs, I will say that they do not need to get an authorization code since it is not going to the state laboratory.
Next question, is Iowa's governor being aggressive enough in ordering preventative measures? Would you prefer Iowa had a shelter in place?
I do know that the governor is being advised by the Iowa Department of Public Health on the shelter at home issue. They have come up with a methodology for determining when or if this is necessary that considers a number of factors, including how many cases, how many deaths, how many hospital beds are occupied, and the like. And it appears that they're doing their due diligence on this issue.
Next question, this will be for Nita. A mobile site opened in Moline yesterday. Are you aware of any additional sites in the works?
I am not aware of any at this time in Rock Island County, although I was just listening to Governor Pritzker's briefing, and they are trying to ramp up other sites within the state, particularly, of course, in Cook County where they have a large outbreak.
Thank you. The last question typed so far, the Illinois governor says the state will be getting more ventilators and masks from the federal government. Any idea on how those will be distributed?
Okay, I guess that's for me too. I have not heard how that's distributed. He just mentioned that in his briefing just a few moments ago. And he just indicated that Illinois would be getting more in the coming days, but I don't think he even gave a timeline for that.
Give it another minute. Please type in any of the additional questions that you have into the chat box. Okay, with no additional questions, we'll go ahead and conclude for today. We'll continue to keep you informed. It may be a variety of ways. Some may be with a scheduled press availability, some may be with some prepared statements, others may be with press releases. So we appreciate, again, your interest in getting this information out and assisting us in this way, and we'll continue to keep you updated. Thank you.